Hey, my name is Tim, and this presentation is for biopsychology about major depressive disorder, or MDD, and psilocybin. We learned about MDD in our stress and depression lecture and the monoamines that are affected by it, and also drugs that can improve MDD, such as SSRIs. We also learned a little bit about psilocybin in our lecture about drugs, which surprisingly has less potential for abuse than other drugs, but can also cause long term problems such as potentially damaging the serotonin system, as mentioned by Dr. Hansen. However, I did find it interesting that psilocybin is widely used in recent clinical research, so I thought I'd focus on two peer reviewed studies that connect psilocybin as therapy for MDD. So, psilocybin is actually not thought to be the psychoactive compound, but when metabolized to psilocin, it acts as a partial agonist to the dopamine and serotonin receptors. Specifically, it's been studied mostly on its effect on the serotonin receptor 5-HT2A. As we can see in part A of this image, number 2, it binds to the receptor, resulting in downregulation. In the first study by Lee et al., they researched a collection of six high quality online databases listed here. They use Prisma guidelines, which is designed to help improve on its reporting, such as how the study was conducted, what they did, and also what they found out about their study. They also used PICO's criteria to ensure that they selected the right studies, which included physically healthy participants at the age of 18 and older, and compared psychological support in adjunction to psilocybin versus psychological support and a placebo. They also looked at the outcomes, which were changes in depressive symptoms, and were measured by multiple standardized scales for depression, anxiety, and many more. The study design that they focus on reviewing were single and double blind randomized controlled trials, or RCT, which again looked at physically healthy patients and excluded any that were not, such as cancer patients, and also making sure that they used the ones with the most complete data set when there were multiple publications of the same data. So out of the 860 articles they found, only 34 were worthy of screening for full text, and only 5 of them matched the criteria. And then here on the right image, I shared a flowchart on how they sifted through these articles. So the results they found were that two out of the five RCTs it had mixed results, while the other three actually benefited from the psilocybin in treating MDD. Also, 80% of the RCT found that anxiety symptom actually significantly improved in psilocybin patients as opposed to the control group, and one group even improved, or in other words, reduced suicidal ideation, which was the Carhart Harris et al. Study. However, there are some adverse reactions, mainly headaches in four of the five RCTs, but this discontinuation rate remained the same, however, between the control group, and the psilocybin group. In the Gaucasian study, they had 24 randomized patients who completed two psilocybin sessions as well as a 12-month follow-up. They all had a grid HAM-D score of 17 or higher, and it excluded anyone with certain disorders as mentioned on this slide. They were also required to refrain from using medications before screening and for at least 1 month following the second session to avoid any interaction that may occur with the psilocybin. All the procedures were approved by the Johns Hopkins Medicine Institutional Review Board, and a lot of preparation was involved before administration with at least one facilitator with a master's or doctoral level of clinical training in mental health. Two doses were administered 2 weeks apart, and a next day follow up as well as a 1 week follow up was required for each session. In the second session, there was also a 1 month as well as a quarterly follow up until they reached the 12th month, and at least an hour long meeting with a minimum of one therapist was also conducted, and of course this was facilitated under high supervision, and all participants had an fMRI scan at the beginning of the study and after the second session. As a result of this study, they found that participants' grid HAM-D rating scale scores were greatly reduced throughout the entire study and even remained above 50% reduction rate. The treatment response for this was quite high at 75%, and the remission rate was at 58% at 12 months and generally sustained throughout the entire study. It should also be noted that 88% of these participants had previously attempted treatment with antidepressants such as SSRIs, norepinephrine, or dopamine reuptake inhibitors, and that a quarter of the participants had previously used psychedelics with an average of about 3 times and over 9 years of abstinence since they've last used it. Most of the participants were also Caucasian. One did identify as black and another as Asian, and three-quarters of them were female. So, in conclusion, both studies were overall pretty positive and showed potentially promising results. We saw that over half of the RCT in the Lee et al. Study participants had improvements in symptoms of depression and anxiety, and one study even showed reduction in suicidal ideation. We also saw that the Gukasian et al. Study, psilocybin produced stable antidepressant effects for MDD patients, lowering their GRID HAM-D scores for at least a whole year. However, more long-term efficacy of psilocybin should be further studied, like the Gaussian et al., or possibly even longer than that. That way, we can also study the safety of psilocybin in the long term. And also, although the Gaussian study showed effectiveness at a longer duration, only 2 sessions were administered within those 12 months. And I think we can gain more knowledge about psilocybin if further studies had active treatment or even a placebo to compare it to, like the Lee et al. Study. Having more participants and a more diverse population would also be helpful in the future research. Overall, clinical research in psilocybin is still relatively new, and only recently in the past decade we have started to heavily study this drug. And here are the two peer reviewed references.